I think we'll move on to the demonstration next. So after fitting the wheelchair, doing a checkout is very important because doing a checkout is the actual validation of the measurements or the assessment or the fitting which we had done. So based on the checkout, we would have to redo the fitting if needed on total wheelchair or on certain aspects. Depends. So I think people who are already experienced in wheelchair fitting will know about the process. We'll have to do a fitting, we'll have to do a checkout, and then again another fitting, another checkout. And this fitting will be an incremental process. So it will not be a one-time thing. Because the standing wheelchair has more components, more complicated mechanisms inside it. We'll have to keep on improving as the person improves. So initially it will be a very easier setting for the person, and later it can be a very expert level setting, so that the person is the wheelchair is fine-tuned according to the person, and the person is not adjusting according to the wheelchair. It should always be the wheelchair should be adjusted according to the person, and the person should not adjust according to the wheelchair. Okay. So in the checkout process, we have multiple stages. We have a pre-fitting checkout and a post-fitting checkout. So pre-fitting is before making the person sit on the wheelchair or try the wheelchair for the first time after the fitting. We'll have to check multiple things because we'll have to have a pre and post. So for example, the skin redness or some skin warmth or some predicting some risk of pressure injury, that we'll have to check before making the person sit, because after the making person sit, we will not be able to find out whether it existed before trying the wheelchair, or is it due to trying the wheelchair, or is it due to something else. To find the difference, always before making the person sit on the wheelchair, do a series of check. We'll see which components to check, and then after making the person sit, we'll have to do a list of check. So in the pre-fitting, we have two positions to check out. One is high sitting position, and the other one is lying down and prone position. And in post-fitting, we have high sitting position, a checkout in high sitting position, and a checkout sitting on the wheelchair while the wheelchair is stationary, and a checkout while sitting on the wheelchair while the wheelchair is moving or the person is moving the wheelchair, and another set of checkout while the person is standing stationarily on the wheelchair, and another checkout for the person when the person goes from sitting to standing or from standing to sitting on the wheelchair. So two main categories, two main time points of checkout, which is pre-fitting and post-fitting. And in post-fitting, in pre-fitting we have two positions, sitting and prone. In post-fitting we have multiple positions. We'll have to do it in sitting on the bed, we'll do it sitting on the wheelchair, sitting while the wheelchair is moving, and standing while the wheelchair is stationary, and standing while the wheelchair is moving, and also prone. So we'll go to pre-fitting check. So while a person is sitting in the high sitting, we can I just read out the points which I have written here. It's all in the checkout guide, which the document which you have received. We'll have to look for skin discoloration. This is before giving the wheelchair, before sitting on the wheelchair. We'll have to check for the skin discoloration around the patellar tendon. Next is we'll have to check whether the skin discoloration, there is any discoloration around the ischial tuberosity, right and left, and then we'll have to check whether there's any warmth at the ischial tuberosity, right and left, and then we'll have to check whether there's any skin discoloration at the sacrum and warmth at the sacrum, and whether there's any skin discoloration at the heel. So basically it boils down to two things. One is we are checking the color of the skin, and we are checking the warmth of the skin. We are checking this in multiple places. One is patellar tendon area, where the knee blocks applies a lot of pressure. Second is ischial tuberosity, where the person bears all the weight on the ischial tuberosity. And third is the sacrum, where the posture is not correct, person will sit on the sacrum. And while standing, the sacrum can have a friction against the backrest. We are looking at color discoloration at the sacrum and the warmth at the sacrum. And finally, if we're looking for any skin discoloration at the heel. So because all the weight of the person goes to the heel, if the person is wearing the right footwear or wearing no footwear at all. So the skin discoloration of the heel will tell us. So during pre-fitting, we'll just make a note of what the color is and how much warmth is. And the color is usually seen visually and good lighting. So when we're doing the pre-fitting check and post-fitting check, we'll have to do it under the same lighting conditions and probably same time of the day. When we are looking, when we are checking the warmth, we'll have to check the warmth using the back of our hand, like the back of the fingers. And that's the most sensitive area where we can find the temperature. So we can note all this down. It will be a simple yes or a no. We'll go into the demonstration later using the form. Next, after recording that, after fitting the person and giving a trial for the person, usually it's given for 20 to 30 minutes. If need be, the person can stay on the wheelchair and try the wheelchair for a longer duration, and then we can check out the post-fitting. So the post-fitting, the first one is stationary sitting. First thing is we'll have to look for the clearance between the weighted trochanter and the skirt guard. I'll just read through all this stuff, then we'll look at all this stuff in the demonstration using the form. Next is whether we'll have to notice how the hips are, the position or the clearance the hips have during doing a push-up. A push-up is a manual for pressure relief. The person gets up and sits. The seat should have adequate clearance so the hips are not getting blocked while getting up and sitting. Third is to see where the top edge of the backrest rests. It should not be too high than what's recommended. It should not be too low than what's recommended. So if it's too high, then probably propulsion will be affected. If it's too low, then balance or posture will be affected during standing as well. And next is in post-fitting, we'll have to check for pressure by the hand check method. Not everyone will have a pressure sensor mat, and experienced person's hand check will do the job. So usually the WHO has made a very good scale for measuring this pressure while sitting. Usually it's measured under the ischial tuberosity. So we can do this hand check as mentioned by the WHO manual. So we can check whether the pressure is more or whether the pressure is less and do appropriate changes. And next is we'll have to check whether the foot plate is supporting the foot very well. So in the fitting we saw that the foot should have good contact. It should not be having very less contact, or it should not be standing on the toes alone. It should not be standing on the side of the foot. And next is we'll be checking whether the foot plate angle is correct or not. So again, this also is very closely related to contact. It should not be having any gap at all. So if there's a gap, and if the gap is between front and back, then it's an angle issue. Next, we'll check the seat depth. Seat depth we saw during the fitting process. The image also shows this. So the image is clear. 2 fingers can be inserted between the person's leg and the cushion, and we can see whether it is free to move the fingers. So that is the post-fitting step for seat depth. Next, during the same stationary sitting, we'll have to check the cushion contact below the distal thigh. So we'll have to check whether the cushion has complete contact with the thigh of the person. This will be important for pressure distribution as well as stability. And next we'll have to check for the knee block contact, whether the knee block has adequate contact with the knees, and whether the knee block has adequate pressure with the well distributed pressure. The pressure should not be focused. It should be well distributed. So the contact will tell us whether it's well distributed or not. And if the pressure is more pointy in some areas, probably the person has lost a lot of musculature, a lot of soft tissue. Then we'll have to probably compensate that with some extra padding. And in post-fitting in stationary sitting, we'll have to check the shoulder abduction angle and the shoulder extension angle. This will determine whether the CG is correct or not for propulsion. So next in post-fitting is we'll have to check the fitting of the wheelchair while the person is moving from sit to stand and moving from stand to sit. So the knee block, first thing to check will be the knee block clearance. So we'll have to check whether the knee block has good contact or not while the person is standing. So earlier we saw the knee block contact while the person is sitting. Now we'll have to see the knee block clearance while the person is standing. Again, we have a small adjustment here, and we can loosen the knee block and then adjust the angle accordingly, but it may not be needed in most of the cases. So it's not a standard measurement, and it cannot be prescribed. That measurement cannot be prescribed. So it will always be dependent on the checkout. So only we don't have that over there. And so basically it's the front and back tilt of the knee block. When the person stands, the knee block, if the bottom of the knee block has more contact than the top of the knee block, then the contact is not good. We have to make the pressure even from top to bottom. Next thing to check out is the lateral thigh clearance. So when the person is keeping the thighs abducted, there should be adequate clearance between the skirt guard and the thigh of the person. If there is not much clearance, then the cloth or the thighs will get caught in the skirt guard. Next is the standing. When the person moves from sitting to standing and standing to sitting, it should be a stutter-free experience. Like the movement should not be jerky. When the person immediately unlocks the standing, it should not like suddenly come up to standing and then it should be very smooth experience from sitting to standing. A relatively smooth experience. So it should not stutter, like stop somewhere between and then go, stop somewhere between and then go. It should be a smooth experience. That is a very important parameter for checking. And there should be consistent semi-standing position. So if the person comes to semi-standing, the person should stay in the same place for that adequate period of time. So this means that when I come to standing for 3/4 of the distance, and when I take my hands, I should not fall down to sitting. Then I will have to push myself from sitting to standing. So the weight assist has to be, this is related to the weight assist. The weight assist has to be correctly adjusted so that semi-standing position is consistent. So if I say I stand at a position of 45 degrees before I take a small rest, short rest, and then move to full standing, it should be the same. Every time I come up, I should be able to stay at 45 degrees. And next one is checking for the terminal sitting ease. So when I go back to sitting, almost when I sit completely on the wheelchair and then when am I able to lock the wheelchair, it should be a very easy experience. I should not feel a lot of resistance when I come to the terminal sitting, when I am about to lock the wheelchair sitting. So if the gas spring is correctly adjusted, then the terminal sitting will be easy. So it should be a balance between stutter-free standing, a consistent semi-standing position, and a terminal sitting ease. That's how the weight assist should be adjusted. And next in the post-fitting is while the person is standing in a stationary position, the knee block height should be measured. We'll have to check whether the knee block height, top end of the knee block is aligned properly at the patellar tendon, and the lower end of the knee block is not way below. This will also tell us about the contact. The knee block should be at least the height, upper edge of the knee block should be at least at the level of the patellar tendon, not too high, not too low. And next we'll have to look for the knee block contact while the person is standing stationary. We'll have to look for the knee block contact at 3 places: while sitting, during moving from sitting to standing, and standing to sitting, and while standing stationarily. So the knee block has to be adjusted accordingly. And while standing stationarily, we'll have to look for the kyphosis or the curvature of the thoracic spine, and the scoliosis and the sideways curvature. So it has to be a very, I think it's very clear in the video. So if we draw an imaginary line from the ear of the person to the shoulder to the waist to the knees and to the ankle, it should be a fairly straight line. It should not be an S-shaped or L-shaped or something like that. So if it's a fairly straight line, then the pressure distribution will be very even and the person will not have a lot of muscular fatigue and not a lot of discomfort while standing. And pressure points will be very well balanced. So we'll have to check for the curvature of the spine. There should not be a lot of curvature. It can be neutral or less curvature. If there's a lot of curvature, then it means that we'll have to check something with the backrest or the seat. Next, standing posture line, same thing again. If you draw an imaginary line from the top of the head to the bottom of the foot, it should be a fairly straight line. If something is not right, then we'll have to adjust the knee block length, then we'll have to adjust the seat depth or the backrest angle. Next is backrest contact while standing. So we'll have to feel how much gap is between the backrest and the back of the person. If there's a lot of gap and if the person is not feeling comfortable, then it should be adjusted. And next will be the lower limb alignment. So again, it should be a straight line between the knees. When looking from the side, there should be a straight line between the hips, knees and the ankle. If it's not a straight line, if it's a zigzag line, then that means there's a problem. Next is post fitting while moving around in the wheelchair. Here there are three components to check. We'll have to check whether the shoulders action are smooth while propelling. So when the person is propelling, the action should be very smooth. While grabbing the wheel and releasing the wheel, the action should be very smooth. And while sitting, we'll have to check for the stability of sitting. The person should be sitting in a very stable posture. The person should not be sliding to front and back very often, where stability is compromised. And again, the stability of the wheelchair and the person should be checked while climbing up a 10-degree slope. I think with this wheelchair, 10-degree slope is a good slope to do an assessment on. While the person is climbing a 10-degree slope, you can check whether the wheelchair is tipping a lot, the caster wheel is lifting a lot, or that the person is losing contact or balance. If that's the case, then we'll have to do some changes to the CG or balance. So post-fitting check, which is done in prone position, we'll check only the skin color and the skin warmth. So first, in pre-fitting we saw 3 or 4 areas. We saw the heel, we saw the sacrum, we saw the ischium, and we saw the patella. We'll have to check all the 4 things in prone or some. For the ischium and sacrum, it's mandatorily prone. For the heel and knee, it can be in prone or it can be in sitting. So we'll keep it prone for simplicity. So we'll have to check for skin discoloration visually. It should be done at the same time with the same lighting conditions as done on the pre-fitting. And then we'll have to look for skin discoloration in 4 areas. One is ischium, one is sacrum, next is patellar tendon, and the last will be the heel. And then we'll have to look at the warmth at 2 areas. One is bilateral ischium and one will be sacrum. See if there's a change from pre-fitting to post-fitting, then that means that either one or many things are not correct. The pressure distribution around the knee may not be correct. The pressure distribution on the footrest may not be correct. The pressure distribution on the cushion may not be correct, or the posture may not be correct. So we'll have to adjust the appropriate parameter. I think we'll move on to the demonstration next. Now, can I request the team from Mobility India to share the screen in a similar way like how we did for the fitting checkout? Okay, so now we all can have a look at the checkout form. We'll go through the components one by one and we'll demonstrate it on the wheelchair. Can we check for the skin discoloration of the patella? So Mr. Karthik, first we'll look at whether you have any skin discoloration on the patellar tendon. Will it be possible for you to fold your trousers up? You can remove the knee block. Then maybe you can raise the camera and Mr. Raju can point out to the patellar tendon area. Okay. Usually during an assessment, people will be requested to wear comfortable clothing. So that area, the skin should be slightly below. Yeah, that area. The skin should be visually inspected before the fitting to record if there's any redness in that area on both sides. And it should be recorded and we can compare it with the post fitting. This is the first check. So if there is any skin discoloration in the patellar tendon on the left side, then we can write it as yes or no. If there's any skin discoloration on the right side, then again there we can write it as yes or no. Simple yes or no over here. We'll be comparing it later. So next is we'll have to check whether there's any skin discoloration over the ischial tuberosity and the sacrum. This has to be done on the prone position. So I don't think we can do that here, but I think everyone gets the idea, right? Visual inspection of the ischial, yeah. So visual inspection of the skin above the ischial tuberosity on prone position and the skin over the sacral bone over the prone position. So there also, if there is any discoloration, like compared discoloration means the change in color compared to the skin on the adjacent area. The adjacent area is kind of dark skin, and if the ischial area is navy black or blue, then there's discoloration. If the adjacent area is light skin and the ischial area is red or maroon, then it's discoloration. So if there is any discoloration, then we can write yes. If there is no discoloration, then we can write no. And it can be recorded on two different sides, left and right. For sacrum, it's only one side. Next is in the same prone position, we'll have to use the backside of our fingers to check the warmth. Maybe Mr. Karthik can demonstrate. You can check the warmth of your forearm. So we can do the same thing over the ischium and the sacrum. Yeah. So we can do the same thing over the ischium and the sacrum. So on the left and right. So this again will be a comparative measure. So it has to be checked on a skin on the relative nearby area. So maybe some 2-3 inches apart from that, away from that area. So if there's any heat or if there's any warmth compared to the skin on 2-3 inches away, then we can write yes, there is a warmth in this area. It means relative warmth. So there's a relative warmth in this area or not. So this has to be done at the ischial tuberosity and at the sacrum. And finally, we'll come to the heel. Um, Mr. Karthik, can you turn to any one side, left or right side? And can you cross your leg and remove your shoe and sock so that your feet, sole of your foot is visible on the camera? Yeah, you can put one leg on top of the other. And yes, so we can check the color difference in the sole of the foot and make a record. If there's any discoloration compared to the region on the compared to other leg or compared to the region around this skin on the sole, then we can record it as yes. If there's no difference in skin color, then no. So discoloration can be blue or black, or it can be red or maroon depending on the skin tone. Yes, thank you. So we are done with the pre-fitting check. So when all is recorded, we'll go with the fitting. So after the fitting is done, then we'll come to the post-fitting. So in the form, the second portion is post-fitting. Now we are going to look at the stationary sitting portion. So can you face the camera, Mr. Karthik? Yeah. Okay. Now, can you keep your knees neutral? Yeah. So are you comfortable with keeping your knees like this? Okay, fine. So now can I request someone else from that side, maybe Raju sir, can you check for the clearance between the greater trochanter and the skirt guard? Put a hand vertically between the skirt guard. Yeah. Yes. So when we do this, there should not be any resistance or any catch. Your hand should not be caught by the person's body or the skirt guard. Is that happening? Are your hands moving freely? Yes, that's great. So that means the hands are not getting caught. The hands are able to slide vertically between the weighted trochanter. So that's an yes. This is a positive sign. So next is shoulder abduction angle. So yes, can you hold the top of the push rim, top dead, top center of the push rim, on the push rim, the wheel. Yeah. So now can you tilt the camera slightly up? Yeah, that's better. So Now if we can see the shoulder abduction angle from the body, this should be 45 degrees or lesser. If this angle is more, probably if you have a goniometer, we can check the measurement. Do you have a goniometer handy? Okay, so the abduction has to be measured from the back, or you can do it from the front if you want. How much is it? 45. That's great. Yeah. So that means that this wheelchair width is the correct size for you. If your arm abduction goes wide, the wheelchair is wider for you. If you sit on a next bigger size of wheelchair, then you will have more abduction. That's not the correct size for you. Okay. So we have passed this test. So we'll write yes for here, and then can you do a push up using the armrest? Yes. Does your hip get stuck somewhere while you're getting up? No? Okay. Then we can write yes for the next component. This is also positive. So hips don't get stuck while doing a push-up. That means we have adequate clearance. So next checkout, we'll go to checking the backrest height. Can you turn facing your back to the camera? So now the backrest should not be any taller than the inferior angle of the scapula. Can someone check it out over there? You can point out two things. So one is the inferior angle of the scapula. No need to use a measuring tape. You just, yeah, this is only a very basic checkout. So the backrest is well below the inferior angle of the scapula. So then this is also a positive thing. So here we'll write yes again. So this has to be done both on the left and the right. Okay. So the backrest, top of the backrest is well below the inferior angle of scapula on both the left and right side. So this is a yes. And next is doing a hand check below the ischium. Uh, can you can you show your side to the camera, and can someone do a hand check for pressure? No need to do it detail, so you can just show how it works. Again, the hand check will that will work with experience. So you can just show how the hand check can be done. So you can remove the armrest. Yeah. So maybe you can tilt to one side, and yes. So basically, the person who's measuring the pressure will tilt the person on the wheelchair to one side and put the hand below the ischium. Mostly two fingers, index and the middle. Put the hand below the ischium on one side, and the person sitting on the wheelchair will come to regular sitting position, and we will check the pressure. If our hands are squeezed, or if our fingers are able to move, wiggle up and down, or whether we can take the finger out at all. If the hands are getting stuck, then it's highly risky. If the finger can move a little bit, probably 5 mm, then it's fine. So the component in the checkout form is the fingertips can wiggle up and down by 5 millimeters under the seat bone. That means the cushion has adequate softness below it. If it can move, then yes. So did your fingers move, Mr. Uh, yeah, did it move? Yes. So the pressure is adequate. So we'll write yes for that. So we'll move on to the next one. So next is checking for the foot plate contact. Can we tilt the camera down at the footrest? Yes. Uh, so can you check whether there's full contact? So this is a visual inspection. So you can see, go close to the kneel down, close to the footrest, and see from all sides whether the feet are in good contact with the footrest. If needed, we can use the fingers to check whether there's any gap. On the other side, okay. Is the entire foot supported well by the foot plate? Yes. Then this is a positive sign. So we'll write yes for that. Entire foot is well supported by the foot plate. Next is we are going to check for the seat depth. So can you introduce two fingers between the popliteal fossa and the front of the cushion? Is there a gap? No. Okay. So then the seat depth is not appropriate. The seat depth has to be 1 point lower. So when the seat depth is lower, Mr. Karthik, can you come a little bit to the front? So when the seat depth is lower, then we'll have two finger gap like this. Now is the gap correct? Do we have two finger easily going in, coming out? Yes. So this is a yes. This should be done on both sides, left side and the right side. So next is the same position. We'll have to check for contact between the cushion, front of the cushion and the distal thigh. So can you introduce a finger below the distal thigh and between the cushion? Yeah. Is there a good amount of contact or is there a lot of gap? Okay, there is good contact. There is no gap when the fingers are inserted between the top of the cushion and the distal thigh. There is no gap. Yeah. So that is a good sign and we will write yes for that. So if there's a lot of gap, then that means either the footrest has to go down or there has to be some padding below the seat cushion. This will be important for distributing the pressure evenly. Uh, so next is we'll have to check for the footrest angle. So we already checked that this is just misplaced. So if the heel doesn't touch the foot plate, can you show an equinus, Mr. Karthik? If the heel doesn't touch the foot plate, then the foot plate angle is not correct. Okay, so the angle should be reduced, or we should have a postural support device. So imagine the foot plate is at 15 degrees and the range of motion available is 0 degrees, then the heel will not touch. So we'll have to make the range of the foot plate to 0 degrees so that the heel will touch. Next, we'll have to check for the gap between the knee block and the leg. Can you put the knee block and turn facing the camera? Now we can check for whether there's good amount of contact between the knee block and the leg of the person. So you can introduce one finger and see whether there's good amount of contact. Yes, is the knee block parallel to the leg? Yeah, that is parallel. So this chest has to be done only when the knee block is parallel to the leg. Yes. Okay. So does one finger go inside? No? Okay, then the knee block should be moved 1 point outside. So Mr. Karthik, can you do a push-up and go a little bit back so that there's a gap in the knee block? Is there any gap now? Yes. So there should be a minimum of one finger should be able to go in and a maximum of two fingers gap. So the gap should be somewhere between one finger to two finger. That means, yeah, the knee block will not compress the knee or the skin of the person while standing. Yes. So now in this situation, so there's adequate gap, two finger gap. So we'll write yes. So this should be checked on the left and right sides and written yes on both sides. Okay. So now we have come to the skin discoloration checking in the post fitting. So now after this check is done, so we can ask the person to take the pant up and take the knee block out, and we can check for the discoloration, if any. So you can just point out to area where, yeah, correct. So we'll have to check for discoloration. We can compare it with a pre-fitting check. We'll have to see whether the color is same or whether it has changed. And if there's a change, whether it disappears in 10 minutes. If it disappears in 10 minutes, then no issues at all. If it stays more than 10 minutes, then it should be an issue. So based on that, we'll have to adjust the padding in the knee block or make the knee block higher or lower or take it farther away from the person. Now we are going to look at whether the person's propulsion ability will be better based on the center of gravity. So when you hold the top dead center of the push rim, top portion, there, a little bit back. Yeah. So the shoulder extension angle should not be more than 45 degrees. So visually I can tell it's less than 45 degrees. Maybe we can use a goniometer to check it. So relative angle between the trunk and the humerus should be less than 45 degrees. Mr. Karthik, can you sit straight? Can you hold the other push limb while he's measuring? You can explain and then you can position yourself. So the stationary arm parallel to the trunk and moving arm parallel to the humerus. I think it's around 30, 35. 40. Okay, 40 is good. It should not be more than 45. Okay, great. So we'll write yes. And if the other side is also same, then we'll write yes for the other side also, right side also. So now we are moving to the next aspect, that is check out during while the person is moving from sit to stand and stand to sit. Uh, I don't think we'll be able to do that. I'm not sure about whether the wheelchair is properly fitted to you. I'm not sure about it. So we'll just have this verbally and explain it verbally. Okay. The chest strap has to be worn loose, not so tight. It has to have at least 4 or 5 fingers gap between you and your body. Okay, okay, fine. So otherwise, when you're standing, it will catch you from standing up. Okay, fine. So now we locate the outside of the knee block. No, not the cuff part, the foam part. Yeah, the outside. Yeah, so that one should not come into contact with the skirt guard while you're standing up. So while you're standing up, the skirt guard will rotate down. Yeah. So when you're standing, this should not happen. Can we have a look at it? You can stand and sit if you're comfortable. Yeah. Yes. Does the skirt guard touch the knee block? Okay, that's great. So the skirt guard outside of the knee block does not touch the skirt guard on either side. So it is a positive sign. So we'll write yes for both the left and the right. Okay. So again, can you sit down and stand up again? So while doing sitting down and standing up, does the skirt guard touch your thighs? Does it press your thighs? No? Okay, that's a good sign. So the side guards or the sides of the wheelchair does not press into the user's thighs. So we'll write yes for both left and right. That means the wheelchair sizing is correct. Okay. Okay. Have you locked the wheelchair in sitting? Okay. Can you just unlock? Don't stand up. Just unlock the wheelchair. No, not that. Standing. Just unlock the standing mechanism. So this initial push should not be there. That means the weight assist is not configured according to your body weight. So when you unlock, the wheelchair should not push you immediately without you trying to actuate the movement. So there should not be any initial jerk. This is so much more than a jerk, it pushes you into standing directly. This should not happen. So when this is present, then we'll write no. So I'll read from the form. There should be no initial jerk when the standing is initiated. There was initial jerk, so we'll write no on both. We'll write no. Okay. So when after the weight assist is adjusted, the gas spring is adjusted, then we'll try it out again, and we'll keep on adjusting until you don't like the standing wheelchair does not push you up immediately after you unlock the mechanism. Okay. So maybe we can show this again from the side. You can turn yourself facing the camera to the side, and we can see this initial pushing up once more. No, I want to see it from the side. Can you go a little bit away from the camera? Okay, can you demonstrate the standing again? Just unlock, don't stand. We'll see how much the wheelchair pushes you up. Yeah, this should not happen. It's a sudden push, it's a sudden jerk to standing. It should not happen. If this happens, a user who has less balance will be pushed forward. They will fall forward. So always before using the standing wheelchair, the weight should be adjusted accordingly. So this is a no here. Okay. So next one. So when you can you push the wheelchair to standing slightly higher, not to complete standing, somewhere 90. Can you take your hands off? Yes. When you take your hands off, you should not automatically come down to sitting. Okay. So there should be some kind of consistent semi-standing angle which should be maintained. Yes. There should be some kind of consistent semi-standing angle. It should be somewhere here. If the semi-standing angle is consistent, if the person does not fall into sitting as soon as they remove the arms, then our checkout is good. Checkout is positive. So the user does not fall back to sitting when the hands are lifted at a semi-standing. So terminal standing it's fine. Complete sitting is fine. Somewhere during midway, if one takes the hands off and if they go to complete sitting, then it's a no. For you, you don't go there. So you can stay in the semi-standing angle. So I'll write yes. So this is a positive sign. Okay. Can you sit down? So the last 5% or the last 7% of sitting, is it very difficult to pull yourself back? Do you require a lot of muscle force? Do you require? Okay. So if you require a lot of muscle force, then it's not good. So the terminal sitting should be easy. Okay. Is the terminal sitting easy? Okay. So then it is a no. So terminal sitting should be easy. This has to be adjusted at the gas spring. The tension of the gas spring should be adjusted so the terminal sitting is easy. So this will also depend on the upper limb strength of the user. So if a person is very strong, then they can probably sit using the muscle power. If the person is weak, then it will be difficult. Okay. So moving on to the next component, which is stationary standing position. Um, can you stand up completely? Sorry, can you turn the wheelchair towards the camera and stand up completely? Can you go a little bit back? Okay, fine. Can you stand up completely? Okay. So the next component in stationary standing position is the top of the knee block should not go higher than the center of patella. Can you check that? Does the top of the knee block go higher than the center of patella? Okay, the top of the knee block doesn't go, right? Yeah. Okay, then that's positive. If the top of the knee block goes higher than the center of patella, then we'll have to decrease the knee block height. Okay, so we'll have to write yes here because the top of the knee block doesn't go higher than the patella on both the left and the right sides. So we'll write yes. This is a positive sign. Next, the top edge of the knee block should not go lower than the tibial tuberosity. Okay, so top edge of the it is way higher, so it is positive here. So the top edge of the foot knee block, no, it should say somewhere between the middle of the patella to the tibial, between the middle of the patella and the tibial tuberosity. It should stay somewhere, and it is well in that place. It is correctly in that place. So this is also positive. We'll write yes for both sides, and yes. Next is we'll have to check whether the knee block has full contact with the user's legs. So there should not be more contact on the inside, on the medial side, and there should not be less contact on the lateral side. Is it so? Is the contact even? Yes, that's great. So we'll write yes for both the sides. The contact should be evenly spread from left to right and top to down. Okay. So next, maybe we can just remove the brakes and sorry, we can just take the camera up so that we can see Mr. Karthik's spine. We can see the shoulder level to see whether he has any scoliosis. Yes. So I can tell your shoulders are the same level, both the left and right shoulder are the same level. So you don't have any lateral curvature at the spine. Okay. And same thing, yeah. When we look from the side, so there seems to be a lot of lordosis. Yes. So this means the rear portion of the cushion should be removed for Mr. Karthik. Yes, that can be removed. That is kept for persons who have very less musculature near the gluteal area. So if that is removed, probably the spine will be in a straight line. That is fixed with Velcro, you can remove it. Yeah. Or you can actually reduce it. So while working on the field, so you can trim it down to a thinner cushion so that you get adequate support and the spine is not straight. Mr. Karthik, can you just lean forward slightly and stand straight? Just to demonstrate neutral standing. Maybe the chest strap can be loosened. Yeah. Hmm. The person will have a slight lordosis, but what you had initially was a lot of lordosis. So can you lean slightly back, little more back? Yeah. This should be correct. This should be fine. So in this position, the backrest will not have any contact because the cushion has to be adjusted, and the cushion should be relatively new. We should check for the stiffness of the cushion and probably trim it down or change to a different cushion. Otherwise, we'll have to work with the backrest setting. So in this position, your spine is relatively neutral, and we'll write it as yes. Can you lean back? Here your spine has excessive lordosis, so this is not okay. If this was the case, or if kyphosis is the case, can you show kyphosis? Yes, if kyphosis is the case, then these lordosis or kyphosis definitely not good. So this will be no. If both are present, we should redo the fitting of cushion of backrest and then check it again. Okay, so we're measuring only the thoracic spine. We're not doing anything to the cervical spine or the lumbar spine. And next, in this straight standing position, if we can draw an imaginary line, if you can take a photo and then draw a line, so from the mastoid process to the acromion to the AS to the iliac crest, yeah, inch tape is good, yeah. So to the iliac crest, to the lateral condyle of the knee, and to the lateral malleolus. Yeah, if this falls in a relatively fairly straight line, then the posture is good. So from here I can tell it's a fairly straight line. But if you are bending back, if you are standing in lordosis like you did before, this is not a straight line. So if you can take it to the math, so this is a very far deviation from the line. So this is not correct. So when we stand, so there should be, can you come back to neutral? This is a fairly straight line. This should be achieved. If this is the case, then we'll write yes on left and right side. You'll have to measure on both sides. This shows good fitting. So it will have something to do with the knee block length. It will have something to do with the knee block height. It will have something to change with the seat depth or the backrest angle. And sometimes the chest strap, if it's worn tight, it will not be good. And the cushion. So multiple parameters have to be adjusted on the wheelchair to to get the neutral posture. And so now we are going to check whether the backrest has complete contact to the back of the person. Here we can very visually see very well there's no contact at all. So in the neutral posture, that means in the neutral posture there should be good contact. So here we don't have any contact, so we'll write no. So this should be done on the left scapula and the right scapula. So your left and right sides. And now we can just take a note of whether the hip, knee, and ankle are in the straight line. We already saw they are in the straight line, but can we tilt the camera down a bit? Ankle is not visible. Okay, so maybe we can use the inch tape to check whether it is straight. To the lateral iliac crest, lateral condyle, and the lateral malleolus should fall in a straight line. Yes, yeah, it's a straight line. So this is a good sign. So we'll write yes for both left and right. And yes, now standing is over. You can come back to sitting. Okay. So while you're propelling, can you show your back towards the camera? And once you're turned, you can just mimic propelling. You need not propel the wheelchair. You can just mimic propelling. Yes. Can you act as if you're propelling? Can you mimic propelling? Yeah. So basically, the medial arm should not get in touch. Should not be touching the push handles or the backrest. So you can, Mr. Karthik, you can stay in the same place. Just move your arms as if you're propelling. Just move your arms back and front. Yeah. Does your arm get hit anywhere in the backrest or the push handle? No. Okay, then it's good. So the shoulders are free to move while propelling. So this is yes on left side and right side. If the seat width is wider than what you require, then the arms will get stuck in the push handle or the backrest. Then that's not a good thing. And if the backrest is too tall also, it will be the same case. Yes. So now to mimic narrow, so the wider wheelchair. So yeah. And can you turn facing the side? Okay, yeah. So when moving, the user should not. You can remove the knee block. This is to show only using the wheelchair as a regular propelling wheelchair. So you can remove the chest strap as well. So while moving, while propelling the wheelchair, you should not slide to the front and back again and again. Can you just slide to sacral sitting? This should not happen. Now can you do a push up and go back? Again slide. Okay, this should not happen. Sliding, adjusting again, sliding, adjusting again. During propulsion should not happen. It will be in a very ill-fitted wheelchair if it happens. So, and it will cause pressure increase at the sacrum and the ischium as well. So, if you are not sliding while propelling, then we'll give yes for this component. Um, Yes. So next is while you're climbing a ramp. So I think due to lack of time, we'll not take the wheelchair outside and show all this. Maybe you can just demonstrate a wheelie. Someone, Mr. Raju, can you hold the wheelchair behind and show a small wheelie? Yeah. Thank you. So this lift up and put it down, lift up and put it down. Yeah. This should not happen while climbing up a ramp. So if this happens while climbing up a ramp, then the CG is way forward, it should be moved back. The wheel position is way forward, it should be moved back. When climbing up a 10-degree ramp with the wheels correctly aligned, this will not happen and this should not happen. If this doesn't happen, if the wheels don't pop up while climbing a 10-degree ramp, then we'll write yes. The wheels pop up, then we'll write no and then adjust the CG. Okay, enough. Thank you. Next is we are going to look at checkout in the stationary sitting or prone position. Again, we'll have to do all this skin checks, visual inspection for color at the ischium, sacrum, the patella, and the sole of the foot. So we'll have to do a skin check, visual skin check, and we'll have to do a skin temperature check. We'll have to check for warmth. And this data can be compared with the pre-fitting checkout. Okay. So with this, we come to end of the checkout process. Okay, then we will go ahead with the last part of this session, which is the user training.